All right, if you're with me, then you decided you'd like to know something about test anxiety, and you might have already known about this before. Hopefully it'll be at least a refresher, if not some new information. So quickly, I think most of us would know by now what test anxiety is. It's a fear or a panic related to a testing situation or an assessment situation. I put down performance because when you are doing practicals or being tested on skills, that's also a part of testing anxiety. It's also any aspect of assessment or evaluation. And I think most of you know by now that you're being constantly evaluated even when you're not taking a test, or at least it feels that way sometimes. So the good news is, because test anxiety is actually a learned response, it can be unlearned, and I hope to teach you a little bit about that today. We have two types of testing anxiety. You have situational, which is normal. Almost everybody has some increase in anxiety when they're thinking about taking a test. If they don't, they might not perform at their best. And long-term or dysfunctional. Are you experiencing test anxiety? These are the symptoms there: nervous, anxious, pounding heart, butterflies, short of breath, a little nauseous, desire to escape, mentally blocked. That means you were in the test, you came in feeling like you knew everything, it left you, and then as soon as you left the exam, things started coming back to you and you questioned why you answered particular ways. Desire to escape, clammy and cold hands, and so forth. The main causes of test anxiety, the number one is not thoroughly being prepared. And I like to throw in number two, which is not being able to really assess yourself on whether or not you have mastered the material. That can be difficult for you guys because you don't always get practice tests. You do get, hopefully, course objectives or a syllabus. And if you use that syllabus or course objectives as a way to review what you've learned, how much can you answer from your head on the weekends or before an exam, that would probably be the best use of those. Programs like SOMA, where people have traditionally kind of created study groups, they'll divide up the course objectives and then people will look up the information and then share that information. To me, that's not a great benefit because you're not challenging yourself on the information to know how well you've mastered it. Other causes, just low self-confidence and equating your academic success with your worth. Believing that you have no control in the situation. It may feel that way, but we forget when we start to get emotionally activated that our thoughts will usually validate the feeling that we have rather than give us reasons to feel something else. And so we need to look at, what do I have control of in this situation? I may not be able to control what questions are on the exam, but I have controlled how much I could study. I can control how much I review. I can prepare as much as I can. I can use some of the cognitive and behavioral things that I'll talk about in a little bit to prepare as well from a mental and emotional standpoint. Unrealistic expectations, that I have to always get in the A's, or people will say they want to, but what they mean is they expect they need to be at 100% or at least in the 90s. I like to remind all of you that, you came from, I grew up in Wisconsin, so milk reference here. Big canister of milk, as soon as it comes out of the cow, the top part is where the cream settles. And we think of cream as like being rich, and, we separate that, and then the cream itself will separate into layers, and you have table cream and you have creme fraiche. So when you were in high school, you were with all of the milk and the cream together. And then you went to college and that was the cream. And then you went to your program now, and that's an even smaller amount of the cream. You're the creme fraiche of all of that milk and cream. And some of you are going to be at the lower end of that creme fraiche. So you have to remember that you came from somewhere and that you are still excelling being where you are today, even if it doesn't feel like it. Other causes, a little bit more detail here, and I'll make this available. If any of you want this, you can email me at amatthews@atsu.edu. Biological factors and physiological effects. The activation of the fight or flight response, I think most of you know about that by now. When your amygdala triggers the limbic system, that's the only part of the brain that's really functioning. Your frontal lobes, which is where you can use analytical and logical thinking, and also inhibits responses, negative responses perhaps, impulses. That is offline. So we've got to get the emotional activation level down before the frontal lobes will kick in. So I'm going to give you some techniques to do that. So fight or flight response, I think most of us know about that. Physical symptoms and feelings of anxiety create an unbreakable cycle. So if it stays activated, like I said, those thoughts will just validate why you feel that way, why you should feel that way, because your brain is trying to get you to escape or to fight, which I hope you don't do in a testing situation, but you may feel like you need to get out. The brain can eventually shut off. That is usually what happens after we have experienced a panic attack. It will shut off because we burned up all of that adrenaline. We can also do kind of the possum play dead thing, which is fight, flight, or flee. Fight, flight, or there's another F. Basically means you just freeze. There it is. And the body's reaction to an intolerable level of stress that cannot be removed. Cognitive factors and influences, thoughts and assumptions can create reality. If my PAs are in here, they've already heard me talk a couple times about how thoughts and events converge to create the feelings that we have. Something happens, we become aware of it, we're involved in it, or we just have a thought that comes to our mind, and then we have judged either ourselves or the circumstances in a negative way, and therefore we feel negatively. That judgment happens so quickly and it's automatic that we don't even realize that it has happened. However, if we can bring the excitation level down enough with some behavioral things, we can eventually move into challenging those thoughts on the basis of reality and trying to moderate their effects on us. I like to use this example that the mind is like a garden, and the thoughts you sow lead to the emotions that you reap. So if you have anxious, fearful thoughts about something, you are going to feel anxious and fearful. So trying to shift that emotional reasoning into something that may allow us to have some anxiety. I think, again, some anxiety about the test is important, but it's a functional level of anxiety that improves our function, not impairs it. Avoidance and procrastination are often a big part of test anxiety. We tend to want to avoid things that we feel uncomfortable about. So if we're anticipating negatively what an exam is going to be like, we will engage in some procrastination. Another word for that in psychological terms is denial. And then we get to a point where we realize we just can't deny anymore and we have to throw ourselves into the work. Some people have come to rely on that procrastination and that sudden rush of energy to work to help them be successful. But that is not going to work in this environment because this is not a 100-meter dash. This is a marathon, and you have to mete out the energy that you use and sometimes even pull back so that you know you have energy for another thing that may be more difficult coming up. Once we start cramming, we have that heightened anxiety that leads to self-doubt. Self-doubt leads to more anxiety, increased pressure to improve performance, and then that exam means so much to us that it triggers that fight or flight response. We have associated death with failure of that exam. Why is it ineffective? Information's not fully understood and integrated, so you can go over the information again and again and again, and it will not stick. It's a wet wall and wet mud, and it'll just slide right off. Information can become disorganized. We can think that we know something or associate two things that are not associated, and information is forgotten and not transferred into long-term memory. Critical factors affecting test anxiety: ineffective study habits, procrastination, physiological stress response, our negative self-talk, lowered self-confidence, and increased internal pressure. The good news is you can make changes that will decrease test anxiety and your performance. Again, some anxiety beforehand is good and expectable. It becomes a problem when it's interfering with performance. We have to address both physical and cognitive aspects that are influencing your panic attack. So oops, I didn't mean to do that. Let me go back. Or not, we'll just move ahead. So truth about stress, here's that stress and performance relationship. And you can see here, if the stress level is extremely low, we're not going to put out much. We're not motivated, not maybe attending like we should. So the performance is low. If the stress is moderately high, then we have an optimal level of performance and we tend to do better. Too high on the stress, we have high risk, and again, low productivity. We can't focus, we can't attend, and we're not doing our best because we're distracted by the feelings and the experience. My mouth is very dry today. So I did a little surfer dude on here because a lot of you are trying to get the most out of this stress performance relationship. Maybe not even knowing that it's there, thinking you have to push and try harder and try harder. But you know, when we hit that one level, you're gonna wipe out. And then on the other side of this is recovery. And we want to try and avoid recovery because recovery takes a long time sometimes. So also connected to this, which I didn't include in the slide, is at the low motivation or low risk area, this is where our brain can be the most logical. And on the opposite end, where the red lines are, this is where our brain is the most emotional. So we study and learn information better at the low risk end, and in the middle, then we're able to attend, focus, we have greater persistence and motivation in that optimum performance level area. So let's get to reducing the anxiety. Again, the first thing is learning to properly prepare for your exams. You've now all had at least one exam. Some of you have completed a course already. So you know what tests look like, and you can kind of understand how you need to prepare. Now let me give you a little caveat. Each time you go into a new course and you may have a new course director, you may have to relearn how to take their tests because they may look somewhat different. Or in going from one subject matter to another, that those exams may look differently because you're learning about the information in a different way. Pharmacology, for example, I can't see pharmacology. I have to create compare and contrast tables. for pharmacology so I can make it something that I can see. I do really well in anatomy because I can see that. I'm also a kinesthetic learner. So you see the kinesthetic learners kind of feeling their own body when they're learning anatomy, or moving their arms around when they're trying to think about physiology. So you'll have to take different techniques and tactics to learn information differently in each course, probably. So learning to properly take tests, stop procrastinating, and I mean now, because if you're gonna think about not procrastinating, now you're procrastinating, not procrastinating. Learn how to relax. A lot of you have gotten here because you've worked very, very hard, and you may have forgotten that your stress level, your idea of what relaxed feels like isn't really relaxed. It might be a mid-range of stress, but it feels relaxed compared to where you've been, but we need to get it lower so we can get you further away from that fight or flight kicking off, so that when you are more stressed, it's at a lower level and you're further away from that fight or flight response. Facing our fears, fight distractions. That means phones, tablets, apps, social media, OPP, which is other people's problems. People may come to you. We're all helpers. We all like to help other people. And so we tend to like collect people that might need help. And we need to remember that you will teach people how to treat you. So if you accept a particular behavior from somebody, they will come to expect you to allow them to do that again. So if they come to you and they just emotionally vomit all over you after they've had a bad test, and you sit there and you listen and you kind of nod your head and you try and be empathetic, and then you move on, you might have absorbed some of their own anxiety about testing. Or if you're talking about an exam before you go in and you have other people coming in with just a high level of excitation, you come away with that, sharing that level of excitation. I use a tuning fork example. When I was in high school, we had a guy come in and it was tuning the piano in the choir room, and we kind of watched what he was doing. He had this big box of tuning forks, and he took one out and he struck it and he said, "You want to see something cool?" And I said, "Yeah." And he passed it over the other tuning forks, and then he held the one that he had struck, and you could hear the other ones vibrating a little bit. So we are emotional tuning forks, and we will take other people's energy and make it our own. So be careful of how you engage with people and know when you need to separate yourself. Preparing academically, I'm not going to go into this. Oops, let me go back. I'm not going to go into that too much because another department covers that, and they're going to cover a test anxiety workshop, I think in September. So just quickly, to me, and I've been a learning resources person before, I was a counselor, so study is not reading and rereading and more rereading in order to memorize. Studying, you have to recall what you've memorized and understand how to use that information to solve problems. And that may mean spending 2 to 3 times more time and effort than you have before. Of course, the day has become 2 to 3 times longer, so that's not really a problem. So we do really have to understand our learning style and make sure that we are using study strategies and skills that are the most effective for us. So a big shout out to Learning and Disability Resources for you to try and help yourself understand that. If you want to truly understand the content, you will do well. If you have negative feelings about a professor, or if you have negative feelings about a particular content area, those things are going to become barriers to learning that information. So try to disconnect feelings from the faculty member or the presenter. Focus on the content and what is its value to you, and try to find some way to increase your interest in that subject matter. So here are the folks in the learning resources area. Crystal Hendren is a learning resources advisor, and Stephanie Ingalls is as well. I was going to tell you where they're located, but that really isn't important right now because we're not seeing anybody face to face. But you can email them or call and they'll help you set up an appointment. If you want to speak to somebody about a learning disability, then that would be Marty Allison. So preparing mentally, what people feel is a byproduct of how and what they think. So your feeling is influenced by your judgments again and what you're reacting to. So feelings are created by the thoughts we have about situations. This example quote from Epictetus, which I used to say Epictetus, it is not what happens to man that disturbs him, but the judgments he makes about those events. So I use an example of, if I were to walk in the room and hand you a kitten, how would you feel? Happy? Because kitten means what? Kittens are cuddly, they're furry, they purr. They're just cute. Every little animal, it starts out with these big eyes and little heads. They just look so cute. So that may be one person's reaction to that. And another person sees a kitten and goes, oh God, get that stinky thing away from me. They poop in a box and, you know, they scratch people. They have horrible bacteria under their nails. They can kill a bird by just scratching it. Get that thing away. They suck the life out of babies. This is an old wives' tale that I think SIDS deaths occurred and babies would have a cat laying in the crib next to a SIDS death and they think that it sucked the life out of the baby. So the cat's the same. It's the same kitten, but I've handed it to two different people and it's their judgment of what that cat means that gives them what they feel. So you can apply that even to exams. You know, if you think of an exam as something horrible and awful and terrible and unbearable, that it means ultimate failure, that it stands between you and this idyllic future that you're thinking of, you're going to have a lot of stress and pressure to perform on that exam. And we want to back that up. All of you have gotten here because we chose you based on the criteria that we wanted our students to have. And this might hurt, but you all met that minimum expectation. If you remember minimum expectations rather than maximum expectations, you can sometimes lower that stress level. So you all got here because we wanted you, and you got here because you have a history of success. You can't negate that history of success just because you're here now and this is different. And you're going to look at one exam score as an unending pattern of behavior. All right. Cognitive restructuring. This is a process of identifying the thoughts that are problematic and replacing them with more realistic and positive ones. Changing your thoughts about yourself, your competence, what the test means. And notice I said more positive. I didn't say positive. We're talking about making our distress less rather than being happy about having an exam, saying, okay, well, it's an exam and it's one of many and I've taken several before, so this is really no big deal. It's just the next hurdle to get to the next thing I need to do. Relaxation techniques. So here we're going to talk about ways to relax your body, keeping your body relaxed, and being able to have the stimulus of your anxiety in your mind or being in that situation while still keeping your body relaxed. Controlled breathing is my number one on this. Now let me back up for just a second. we can inoculate ourselves against stress by maintaining good self-care. So activity, number one, 20 to 30 minutes at least 3 times a week. Daily would be great. 5 days a week would be better than 3. But 3 days a week, getting your heart rate up over 120 beats a minute, sustained for that amount of time. Now, the good news is it doesn't have to be 20 minutes in a row. It could be 5 minutes, 5 minutes, 5 minutes, 5 minutes, 10 minutes, 5 minutes, 5 minutes. It just accumulates to 20 minutes a day, 3 times a week. That's sufficient for improving our stress management. Eating properly, prepare meals on the weekends, have them in the freezer. Sleep, making sure that you're getting the amount of sleep that you need. And if you're cutting back on sleep for more study, it's only going to work for so long. And then you're going to have such a sleep deficit that you're going to have to hit recovery. Socialization and meaning. Making meaning out of what you have, making meaning out of the struggle that you may be having right now, that it is going to make you a stronger student and a stronger professional. All right, so breathing techniques. If you remember nothing else about trying to control your breathing, making it deeper, slower, quieter, and more regular. When we are more anxious, we tend to breathe very rapidly and very shallowly. Sometimes that makes a lot of noise. People come over and go, "Are you okay?" Because they can hear us breathing at such a quick rate. Making your exhalation twice as long as inhalation and completely expelling all of the air that you have in your body. When we are breathing rapidly, we retain a higher amount of tidal volume in our lungs, and that tidal volume has lower oxygenation, so we need more oxygenated air. So these 2 ways of generally thinking about breathing differently will help you to do that. One of the ways to stimulate your parasympathetic nervous response is to increase the oxygenation in your blood. Progressive muscle relaxation, this is more of a technique that you would use to overall lower your stress level, not necessarily that you would do this when you're having test anxiety. These are all to do before. We start with the feet and we curl the toes and arch the feet for 15 seconds or 20 seconds, and then you release for a little bit longer. And then you add the calves, feet, and toes. Same thing. Thighs, calves, feet, and toes. So you just add a muscle group up your body until your whole body is tensed and released. If you have trouble falling asleep at night, doing that progressive muscle relaxation technique can be helpful to get you to a point of feeling relaxed enough to fall asleep. So this is a breathing technique that I like. It involves counting. Some people can do breathing techniques that involve counting and feel good about it, and other people, it makes their anxiety worse to be focused on the counting. Am I doing it right? Should I do it faster? All of those kinds of things. If counting doesn't work for you, just don't do it. Do one of those other things I just covered. But I like this breathing technique. It has helped me immensely. I've lived with anxiety and depression since I was a young boy. So this breathing technique I credit for getting me through my master's program. So if you can look at the little window where I am, I use my fingers here. My thumbs represent my front teeth, and this is the roof of my mouth. If this is my tongue, this other finger, we're going to touch the tip of your tongue to that bend of tissue right behind your front teeth. And you're going to hold it there the whole time you're doing this breathing technique. What I have on the screen is 1 cycle. We do that for 4 cycles. So it looks sort of like this. This is 1 cycle. Tongue in position, about the thickness of a finger behind your front teeth. We're going to breathe in through the nose for the count of 4. We're We're going to hold the breath for the count of 7 and blow out through the lips for the count of 8. And that'll be 1 cycle. So it goes like this. You want to get all of the air out again that you've inhaled. So 4 cycles of that, then you just breathe normally. If you're going to practice this, I would suggest that before you do it, kind of do a scan of your body. Where do you have tension in your body? Where do you have discomfort? And then do the breathing technique and check again. Where do I have tension, stress, discomfort? See if it's changed at all. Some people feel like they're a little dizzy when they get done with this. That's okay. It could do that until you get used to it. You can count as fast or slow as you like. You just need to keep that ratio of 4, 7, and 8. So you'll notice here it says practice twice a day for 4 weeks and then use as needed. And then after 4 weeks, you can increase it to 8 cycles. I really highly encourage you to practice it twice a day. Number one, it'll help you if you're going into an exam to have it memorized, how to do it, what it should feel like. And also when you have panic pop up really quickly, you might try and do it going to the restroom or something. You need to have this almost as muscle memory to do it, so you can do it when your brain doesn't want to focus. Here's the progressive muscle relaxation in a slide. Basically, again, we're just tensing different muscle groups up the body. There's my animation, it takes too long. Don't expect perfect alleviation of stress or even success at reducing the stress at first. You need to practice this just like any other skill. It may take 15 weeks to create a habit. So work on that. Don't judge yourself if you fail to achieve relaxation. It's one of the biggest problems for our students. We have a lot of, in the Myers-Briggs constellation, have judging as one of their learning characteristics or their personality characteristics. And that means we tend to sometimes be too judgmental of ourselves. So be kind to yourself, be compassionate. I'm learning to do something new. It's not giving me the outcome I want just yet. Looking at controlling our thoughts, we can control our attention. We may not be able to sustain it very long, but we can shift our control, shift our attention. We want to focus on one thing at a time as much as possible. Be the director of your intention. If it goes away to something else, bring it back. Again, don't judge yourself that it went away, because that's human. Every brain's going to do that. Using positive self-talk. I can do this because I'm prepared. I know generally what to expect. I can expect to miss some questions. My feelings are not me and not reality. Not everything your brain tells you is true. Don't listen to it when you are emotionally activated. You want to work on lowering that emotional level and then moving into challenging the thoughts. Always work on trying to bring the emotional level down first. So this feeling is not me. Anxiety is not who I am. I don't need to let it affect me. And just because I'm scared doesn't mean that I'm predetermined to fail. If I nurture the fear, I likely will. So again, we need to practice, refine our rehearsal. Don't judge. Oh, this kind of ended quickly. That's not where I want it to end. Might not have pulled up the right slide. So now I'm going to come back to me, and I'm just going to talk a little bit about some of the other things about test taking. So tests in graduate school are no longer like identifying and associating and matching, defining. Now we have to use information to solve other problems. So you may get scenario type questions. Some of the tips to taking those questions are, this is the way I do it because I needed to. I've taken the nursing boards and I've taken the counseling boards, and it helped both times. When you see a long block of text, instead of getting scared of and thinking about, I don't have much time for each question, go to the bottom of that paragraph and read the last sentence so you can figure out what you're solving for, and then go through the material, because that might also help you to understand what parts of that are unnecessary. You can also look at the last line and then look through the answers and see if that triggers anything. One of the test questions I had on my nursing board's kind of ridiculous. Long amount of information, all sorts of statistics and vitals on the patient, their lab reports. And at the very bottom, it said, as a nurse, what is your first step? And in the 5 different options was this one answer that said, do a head to toe assessment. It seemed almost stupid to make it that easy, but that was the correct answer. You need to do a head to toe assessment. You've got information there, but it may not be the information that that person is giving you right now. So think about ways to kind of shortcut. If you have a long question and it's filled with information and you don't feel like you can answer it, move it along, don't spend much time, do additional questions and answer them as quickly as you can. Then you'll have more time at the end to pay attention to those questions that are a little bit longer or harder to answer. So you kind of bank some time that way. Some other ways to work on the feeling of anxiety before an exam, some ways that we stop panic attacks. There is hardwiring in the brain that we all have, that if you drink water, you will stimulate the parasympathetic response. Because if you were running away from a bear that was about to eat you, you would not stop to drink water. You would run until you dropped. Same thing with eating. So anything that causes you to salivate or turns on the digestive system is one of the things that's turned off when the sympathetic nervous system is turned on. So chewing gum, hard candies, anything that can help you to salivate, drinking water, other things like splashing cold water on your face. This time of year, it might be hard to find cold water. It's not like we have buckets of ice water sitting everywhere. The way this was actually told to me was, oh, if you're having a panic attack, put your face in ice water, and then hold it under the ice water. I'm like, that's not gonna work. Nobody has that. So trying to do that with cold water, flicking it on your face just to get a little shock value. Anything that increases the pressure in the torso can stimulate the vagus nerve. So if we stimulate the vagus nerve, again, we're going to stimulate the parasympathetic response. So singing, forced laughing, like ha, 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 ha. Something that really gets your body, ho, 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 like Santa, whatever you want to do. Singing, laughing, taking a big deep breath in and pinching your nose and bearing down like you're going to have a bowel movement or trying to pop your ears, though all those things can help stimulate the vagus nerve and the parasympathetic response. General advice, do not study really late the night before an exam. You probably don't even want to study in-depth stuff. You want to just do more review the day before an exam. And then the morning of, if it's an 8 o'clock exam, give yourself plenty of time to take things slow. get up, eat some breakfast, enjoy some coffee or some tea or whatever you drink in the morning. Try to do some mindfulness activity with that. I haven't really talked about mindfulness in this particular presentation, but mindfulness is, I'm using my hand to represent this moment, and this hand is my attention and focus. If I keep my attention and focus in this moment, this isn't such a bad moment. Nothing's happening to me that's negative right in this moment. If my thoughts go into the future and think about horrible, awful, terrible, unbearable things that might happen to me, then in this moment, I will feel anxious or scared. If I think about horrible, awful, terrible, unbearable things that happened to me in the past, then I can be depressed or I can be angry, resentful. If you have a really strong emotion and it's affecting you negatively, try to think about what time zone does that belong to? Because it's probably not this moment. Future, past, putting our thoughts into what we think other people think about us. That's another time zone, or going so deep into our own heads about what we think of us or what we think we should be is another time zone. So each of those time zones can have both positive and negative effects, really. I mean, if you think about the past in a positive way, you're reminiscing, it's nostalgic, that might bring us some happy feelings today. And actually, that is a way to try and work on bringing that excitation level down, is through a guided imagery or an image of a place that you have been that was very relaxing or calming, or a place where you felt safe. I use different ones for myself. Probably the shortest one to explain to you would be, this aunt that I had, she was my grandfather's aunt, but she lived long enough for me to know her. She had all these quilts that she had made, and those quilts were always brought out when we were sick. My mom would like layer extra quilts on top of us, and they had this certain scent that reminded me of Aunt Daisy. So we could smell that, and you feel the warmth and the weight of the blanket. So this safe place image is using your mind's eye, using your imagination to put yourself in that safe situation that you've had in the past. What did it feel like? What did it smell like? What do you see there? What do you hear there? If you were fed something, thinking about the taste of whatever it was, trying to use all of your senses in this imagery to almost put yourself back in that, like a time travel experience. That works because of this part of our brain that doesn't understand the difference between reality that's happening right now and something that we're imagining happening to us. And that's probably that amygdala and the limbic system. If you have gone to a movie that you found to be especially exciting, you're sitting still in a dark room, watching light and dark and color and hearing sounds. That's what's really happening. But in your brain, you're reacting, your body is reacting to the action in the movie like you are doing that. Your heart rate will go up if it's an action movie, and your blood pressure might increase a little bit. Your muscle tension will increase. You might notice yourself sitting on the edge of the seat and holding your arms in. That's the way I felt when I saw the first Halloween movie in 1979, 80. It's like, oh, so we know that our body will be tricked into this. We can use that knowledge to trick our body into the safe place experience if you have one. Some people just don't. They grew up in chaotic families. They grew up around abuse. Thinking back is not going to work for them. So you might need to create an idyllic spot in your head that you would like to go to, or that you are going to create for yourself on the other side of this educational experience and becoming a professional. So it can work either way. Another thing would be bringing up your favorite scene in a movie that is calming and relaxing. So anything you can connect to that way. So let's see, we've covered water and eating or chewing, safe place. Anybody ever have any other ideas? What have you done to kind of think about or to work on your own anxiety?
I listen to like a positive podcast in the morning when I'm getting ready, because sometimes in the morning's like the worst time to think about things in your past or like bad things. So to distract myself, I'll listen to a podcast that I've never heard before. And it's a positive podcast, so it kind of, has that ability to make things better in general. And then you're not distracted by your negative thoughts either.
Right, you're distracting yourself from the negative thoughts with something positive. And I've talked to some people and they say, well, I know this isn't a real thing, it's just distraction. And I'm like, well, wait a minute. If it's distracting you from thinking negatively, why wouldn't you use that and accept it as valid? It's a valid thing. I will tell you right now, distraction is a technique. We need you to do that to get that thought off of this track and onto this different one. I'll use a ship as an example on the ocean. When a ship is moving at a high rate of speed, it wants to tend to go in that direction. And when you make a turn, it's going to take a long time to get that thing to turn. So if you have used negativity to sort of push you into doing your schoolwork, there are people that motivate by fear. And if you're doing that, that's going to be hard to make that turn. You're going to feel resistance to trying to think positively. But the more you do it, the easier it will become, and it becomes a habit eventually. I think the biggest problem, and this goes back to mindfulness, John Kabat-Zinn is a good guy to read or to find podcasts on. Kabat is Kabat-Zinn. He says mindfulness is directing your attention in a particular way, on purpose, here and now, non-judgmentally. And then he adds a couple more things that he doesn't put in his books, which is as if your life depended on it, and it probably does. Because he sees stress as being the main progenitor of illness and dysfunction. So this idea that we can not be on autopilot, we can't be on autopilot. Our brain going on autopilot is what's happening when we go to these other time zones. We feel something, the brain automatically goes to bad thoughts that validate the feeling. So we need to move it a different direction. So sometimes the first step for people is just to direct their awareness to what am I feeling, both physiologically and emotionally, and then saying, well, what am I thinking about right now? What am I focused on that might be producing or inflaming that? Doing some breathing, doing some progressive muscle relaxation, and then trying to challenge those thoughts to be a little bit different. So listening to positive messages is great, especially if they're messages that resonate with you in some way, shape, or form. It's very difficult to listen to positive when you don't feel really positive. Your brain can just go, no, that's not reality. So we just need to be a little more positive. I was actually talking to somebody this morning. They're getting ready for their board exams, their last ones. And of course, they've kind of looked at this board exam as standing between them and the rest of their life, their future. They finished their program, they need this exam, and if they fail this, all hope is lost. And I said, is that true? if you fail this, you will never become a health professional? Well, no. I mean, yeah, I could take it again. I was like, well, that's reality. It may not be what you want, but tell yourself the truth. If I fail this, I can take it again. If I fail it, I can work on the content that I'm missing so that I can pass it the next time. And that content that I'm missing might be really important when I'm actually a healthcare provider. So all of this is helping me. It's helping me to assess where I am and to get where I need to be. So looking at the exam differently so that we can do that. What else have other people done? Yes, Full Catastrophe Living is a good book from John Kabat-Zinn. Listen to music? Yes. If you listen to music while you study, your brain will want to listen to music when you take the exam. So one thing that I would suggest that you do is try to make your study environment as similar to the testing environment as possible. You're not going to be able to take a TV in if you're used to having TV playing in the background. If you can't chew gum in the testing area, chewing gum when you study may not be the best thing. So try and make them as similar as possible. I like to suggest music, especially for getting ready for sleep. Now, that doesn't mean Metallica or reggaeton or hip hop. That means nice, quiet spa type music and music that never had any lyrics. If you listen to music that has had lyrics, even though they're not there, your brain will want to sing along. And you also want to choose music that doesn't have like repetitive stanzas or choruses that you hear over and over again, because your brain wants to pay attention to patterns. Our brains are always trying to find patterns. So if it's constantly changing in pace or modulation or instruments, that's going to help bring you to a level of relaxation. Okay. Well, I appreciate all of you being here. If you have any questions and you're on the Arizona campus, I'm your contact. If Missouri is your campus, then Sarah Thomas or Phil Jorn. Phil just joined us July 1st, so he's a new counselor for us there. You can come out, reach out to either one of them and to me. Apologize for the technical stuff and not having the one great PowerPoint I wanted to share. But everybody, good luck. If you need me, you know where to find me. Here on my laptop. Thanks again. Bye.
Thank you.
Thank you, Art.
You're welcome.